Hey guys, I'm Amber Hudgins. I'm a pharmacist / CPP, which is something unique to North Carolina. I'm actually called a clinical pharmacist practitioner. I am currently supporting our Novant Health Rheumatology and Arthritis Westbrook location here in Winston-Salem, North Carolina. And my role is actually a dual role. So I support both clinic services as well as our Novant Health specialty pharmacy team. So I'm able to be in clinic, help make the therapy decisions, and then also follow my patients while they're on therapy through MTM services as well. So today I'm really going to be speaking to you guys on the efficacy and safety of Ixekizumab, really looking at this drug with or without Methotrexate in biologic-naive patients, specifically psoriatic arthritis patients, and looking at a study that they conducted called their SPIRIT-H2H study, where they compared to Humira and had 52-week results, kind of primarily what we're going to talk about today. So I'll dive in by discussing the abstract introduction a little bit and really thinking of the aim of the study. So the aim of the study was to determine the efficacy and safety of treatment with Ixekizumab and Adalimumab with or without Methotrexate. Methotrexate specifically because that is the most commonly used DMARD that we see, and looking at this data throughout week 52 in patients with PsA. So you may be thinking, why are we carrying out this study? What is it telling us that we didn't already know? So there is limited evidence currently available on the impact of concomitant use of Methotrexate and how that affects the safety and efficacy for these biologic disease modifying agents or biologic DMARDs approved for the treatment of patients with PsA. So the aim of this study was really to focus on the efficacy and safety, looking at specifically Ixekizumab and Adalimumab with and without the Methotrexate in these patient population. So diving into our methods, kind of how the study was set up. So the participants in the SPIRIT-H2H were biologic-naive patients. They had to have active PsA and plaque psoriasis. They needed to be patients who were at least 18 years of age with at least 3 swollen and tender joints, with an inadequate response to at least one of the conventional DMARDs. So these patients had to have an established diagnosis of PsA for at least 6 months, fulfill the CASPAR criteria, and have active PsA, and that's kind of what they defined as having those 3 swollen and tender joints. They also were required to have active PSO with their body surface area of at least 3% being affected. So the trial was set up as a phase 4 randomized open label blind assessor study. And when it came to dosing, it was very typical of what you would see for PsA with both medications. So for the Ixekizumab, they were randomized and received 160 milligram starting dose, the loading dose, so to say. And then afterwards, they received 80 milligrams every 4 weeks as maintenance therapy. Now, for the Adalimumab patients, they received 40 milligrams every other week without an initial dose. And then the primary endpoint, which you'll kind of hear me talk about the most, is looking at the proportion of patients who achieved simultaneously the ACR 50 and the PASI 100 at week 24. So, how did the results turn out? So we found that by week 52, Ixekizumab did provide similar improvements in the combined ACR 50 and PASI 100 endpoint, ACR 50, and other PsA-related domains, regardless of whether or not the Ixekizumab was given with or without Methotrexate. While Adalimumab efficacy really appeared to be improved with the concomitant use of Methotrexate. So when we dive into a little bit more of the percentages there, 36 and 39% of patients taking the Ixekizumab achieved both ACR 50 and PASI 100 at weeks 24 and 52, versus 28 and 26% of patients in the Adalimumab group. So, when used without Methotrexate concomitantly, Ixekizumab did result in a significantly higher response versus Adalimumab in terms of that combined endpoint that we mentioned, minimal disease activity and very low disease activity. So, what did we learn from this study? Kind of what do these results mean? So the results of this study do suggest that Ixekizumab demonstrated identical efficacy in the joint endpoints with or without the concomitant use of Methotrexate, while Adalimumab did appear to increase with the concomitant use of Methotrexate. The safety information of both agents was consistent with their known safety profiles regardless of methotrexate use. And these results kind of give us evidence-based treatment decisions when considering concomitant methotrexate use with our patients when prescribing these agents in PsA. So in conclusion, PsA patients with inadequate control of disease, Ixekizumab does deliver consistent efficacy in several clinical domains of the disease, regardless of using the methotrexate concomitant. It also raises the possibility that it may not be necessary to treat these patients with Ixekizumab and methotrexate. You could actually use Ixekizumab alone. So thank you guys for listening to my discussion today. For more information, be sure to check out the RAP website and ACE app for more information. Thanks so much.